There's something called health culture and the way people actually behave. I would like to tell you that it's even worse with men. You will never see a man going to a hospital unless they are almost dying. And so I think the culture that people have really determines how they perceive health. Because we can appreciate that if you go to developed world like in the West or in Europe, you see people having the routine yearly medical checkup. So when we are talking issues to do, for example, with this cancers, in developed world, people just go for screening, for cervical screening, for any types of cancer screening that you can be able to screen, which is very different from us. We have people advocating, we have media advertisement for people to go for screening, but because of the culture that we have, we can't blame anyone. It's just a personal decision that someone has to inculcate and ensure that they see health as the best way to not become sick is to be preventive, have a preventive approach, whereby you don't have to become sick to go and see a medical practitioner. You don't have to have tooth issues to go and see a dentist. You can just be having routine medical checkup. And some of the things that probably my colleagues are saying issues to do with telemedicine and incorporating of technology into healthcare, in developed world, people usually get even health messages reminding you that you are due for a cervical cancer screening after an year. You are due for a dental checkup after an year. And I think if we can be able to change our mentality, change the way we behave, change the way we perceive health, then I foresee that probably the health status of Kenya will be very good. And just to summarize, there's a health report that came from Mombasa, and they said that 80% of the diseases which occurred were something which were preventable. So you can imagine 80% of patients who go to the hospital in Mombasa County, according to that report, is diseases which are preventable, and 50% of which are actually prevented by simple things like taking sanitations, things to clean water, washing your hands after toilet, and so on. So we need to have the preventive approach and change the way we perceive health and change the culture that we have in terms of healthcare.
Okay.
Yes.
Dr. Mukera.
Yes.
We see a lot of, and I have not forgotten, Dr. Andove, the question on the Nairobi County Health Task Force report. So you give us like a preview for those of us who've not encountered it. But Dr. Mukera, we now see a lot of health professionals on social media. On Instagram, there's a lady who's a gynecologist, and she's she's an influencer. I just can't remember her name, but
Dr. Clark Kinothia.
Yes. Yes. And like I said, I mentioned earlier, I follow lots of dermatologists, and there are people here, okay, aestheticians are not medical, like healthcare workers per se, but I know a lot of people who you know those pimple popping videos, like they just sit and watch those things all the